Hello, and welcome to yet another episode of Healthcare Awareness Programs from Critical Care Unified Private Limited. I have with me today Dr. Raghuram, who is a consultant neurosurgeon and spine surgeon at Manipal Hospital in Bangalore. He has done his DNB in neurosurgery, and apart from that, he has fellowships in a variety of countries. He's got his fields of expertise in areas of brain tumors, minimally invasive spine surgery, trauma surgery, surgery for Parkinson's and other movement disorders, and epilepsy surgery. I am very fortunate to get his time today so that we can explain to the general public and the layman about various aspects of Parkinson's and some other movement disorders. But thank you, Raghuram, Dr. Raghuram, for being with us today.
Thank you, Mr.
And,
Rajiv.
and I would like to start with a thing that has been uppermost in the minds of people, especially after COVID, something called brain fog. And people find that it has affected their concentration, etc. So, what would be your thoughts around on that?
Thank you, Mr. Rajiv, for inviting me for this awareness talk on Parkinson's and other neurological disorders. Brain fog has become a very layman's term. Everybody is talking about it, especially after the COVID pandemic. What basically is brain fog is that patients say that they can't concentrate, their thought process get blocked, they are not able to concentrate and bring out their ideas as easily as they were able to do before. Is this a scientifically proven phenomena? Yes, definitely it is a scientifically proven problem and phenomena that we are seeing in patients, especially patients who have had some amount of serious COVID illness. May not be everybody who had asymptomatic COVID, but patients who had symptomatic COVID and needed admissions, and some patients who have had COVID vaccines also subsequently have come back and told us that I had developed a fever after the vaccine and became symptomatic, and then now I am finding this issue of concentrating. Why does this happen? Basically, it's the same concentrated thing that we are telling. Basically, there's a decreased oxygen supply to the brain when the saturation drops, or when, like all of us know now, it's so common term that when COVID affected everybody, one of the most important organ that it affected was the lung, and lung is important for oxygenation. So when the oxygenation to the brain suffered during that illness, some amount of neurons died, and that's the reason why they feel that, okay, this is difficult to concentrate, I am not able to focus. But is this permanent? Definitely not. So I don't think you need to really get worried if you feel that you are not able to express yourself as well as before. It's just probably a little more effort that you will need for probably 3 to 6 months, and your brain will relearn the whole process, because that's how the neurons work. So in case there is some kind of an injury and they start relearning, and that is called as neuronal plasticity, and they should be able to get back to their original level of concentration and focus maybe in 3 to 6 months. It's just that they should not think negatively about it, but keep working towards improving their concentration and focus, and it would happen.
Very good, excellent. So, is Parkinson's also a condition in which you see some of these factors emerging?
Yeah, definitely. So what is Parkinson's disease? Basically, Parkinson's is a disease in which there is a deficiency of a very important neurochemical substance in the brain called dopamine. So why does this happen? We really don't know. There are some families, especially in India, it's Parsi families are known to have a genetic mutation in which there is a higher incidence or a higher prevalence of Parkinson's disease. Otherwise, in the common population, we are not aware as to why there is an increased incidence of Parkinson's disease. But once the patients develop Parkinson's and we go back and look at their genes, we know that there is an abnormal gene mutation called as the Parkin gene mutation in many of them. But the primary problem in Parkinson's is the deficiency of dopamine, which again can cause all the symptoms that I just now told you. Patients become very hyperactive, they develop abnormal movements in terms of having tremors and all that, which we will discuss further.
Okay. And how would you say, on a broad basis, uh, Parkinson's affects the daily lives of people?
Correct.
And how does it progress from there on?
Yeah. So like I was mentioning, Parkinson's is a disease usually seen in the age group of around 50 to 60 or after 60, except for in select group of patients which I was telling you about, genetic mutations, in which we see them at a much earlier stage, say when they're 40s or 35s. We even have seen patients as young as 20, 25 having Parkinson's, but that's not common. The common age group is about 50 to 60 and thereafter. If you see 100,000 people, there may be about 4 to 5 people who may get Parkinson's. So that is what is called as the prevalence. So why does it affect the day-to-day life is basically the whole brain is completely wired and it communicates with each other cells and other parts of the brain to the rest of the body through electric currents. And how does that happen? With the help of this neurochemical substance called dopamine. So when there is a deficiency of this dopamine in the brain, these electrical circuits become abnormal. So when they become abnormal, you see the common symptoms of Parkinson's, what we call as tremors, which means the hands shiver and shake a lot whenever they are trying to do anything, or even when they are sitting with their hands by their side of the thighs, the hands keep on shaking. So that is one common symptom. The second commonest symptom is they become very slow. That means they are not able to walk fast, their handwriting becomes very slow, they can't eat fast. When they speak, many a time it's not clear, they are not able to understand, or somebody, their close family members are not able to understand what they're speaking. So all these basic things that we need, like speaking, moving, eating, and using our hands, are getting affected by Parkinson's disease, and that's how they affect the day-to-day life.
So some are motor-oriented symptoms,
Correct.
and there others would be non-motor-oriented
Correct.
symptoms.
Correct.
Could you throw some light on some of the non-motor-oriented symptoms that may be overlooked by people?
Absolutely. So like I told you just now, what I described to you is all about the motor symptoms. That means motor, when we means movement. So all this problem of shaking of hands, not able to speak is because of movement of the tongue, not able to walk fast is because your legs are not moving as fast as this. Is Parkinson's only these motor symptoms? Definitely not. There is a lot of symptoms which are called as non-motor symptoms. So the most commonest thing that we see is depression, because many of these patients are elderly and they kind of get withdrawn because they feel, oh, it's so embarrassing for me because I am walking so funnily. It's so embarrassing for me because my hands keep shaking, I can't keep eating food properly, the food spills when I try to eat. So they avoid social gatherings, they don't go and meet their friends. So all these things contribute to the non-motor symptoms, and they become very, very depressed and alone. So that is one of the most commonest non-motor symptoms. Because of the dopamine deficiency, and once they are on the medication, we do see what is called as excessive gambling. Sometimes they develop some funny habits. It's called punding. So all these things also can happen in Parkinson's. So it's not necessarily the movement problem that they can have. They can have all the psychological and other symptoms which are called as non-motor symptoms.
And is there some correlation that maybe if there is depression and for long periods of time there is depression, it also increases the incidence of Parkinson's within a person's system?
Yeah.
Is that correlation the
Yeah,
case?
it's a very good question, Mr. Rajiv. The important thing about psychiatric illnesses and Parkinson is the fact is that many of these patients, they are on medications, okay? And many of these medication, dopamine, like all of us know, is a neurostimulator, right, for the brain. So some of these patients who are very aggressive, they try to give medications which will reduce this dopamine level in the body. So as a side effect of these depression medicines that they're taking for a very long time, they can develop what is called a secondary Parkinson's. So that is a very important point that we need to understand and remember, that patients who take these long-term psychiatric medications have to be regularly in touch with their psychiatric doctors, and any symptom that I was just describing, like they're becoming slow, they're not able to walk, their hands are becoming very stiff, they have to bring it to the notice of their doctor so that he can appropriately adjust the dosage of the medications as well as start them on treatment if they develop secondary Parkinson's.
So are there any stages, would you say, in the sort of evolution of Parkinson's in a person's
Yeah, I
system?
think that is very, very good question again, because it is known and very clearly classified for medical doctors at least into 4 different stages. The first stage, it's called the H and Y staging, based on 2 famous scientists who described it. And the first stage is the one in which the patients are fairly independent, they have just minor tremors, they're able to walk around independently. The second stage is they are on medications, and when they're on the medication, they're able to do it. The third stage is when they develop severe offs. Parkinson basically has 2 groups. One is called as the on phase, and the other one is called the off phase. The on phase is like when if you look at him, you won't know he's a Parkinson. He's as normal as anybody else. And the off phase is the symptom when they become rigid, they can't walk. So that phase, fluctuation between this on and off becomes very severe in the stage 3. And stage 4 is almost the last stage when they are bedridden, because their body becomes so stiff that they can't even get up from the bed.
And would you say that every patient who is inflicted with this Parkinson's disease, has a progression of the disease, or is it somewhere that it also stops and
Correct.
it stays at that level?
Correct. So usually it's a progressive disease. It's not like it's going to stop. But what can we do to delay this progression? I think that is the most important thing that we
Okay.
need to look at. I mean, it's not like the end of the road if you get Parkinson's, especially nowadays when we have state-of-the-art treatment in terms of medication as well as surgical interventions. So the most important thing is to slow down this progression from stage 1 to stage 4. So what do we do to slow down this? We need to create awareness. That's one of the aim of this program also, is so that you identify these symptoms early, you identify them correctly, go to an appropriate doctor and take the right treatment. So that way what happens, once the disease becomes under control, the progression significantly slows down and we can intervene at the right times during these various stages so that the patient's quality of life does not suffer much.
Okay. And are there any standard methodologies of investigation of Parkinson's disease?
Correct.
And how do you then look at or predict what might be the progression of the disease?
Correct. So that's many common question that many of our patients ask. As soon as you tell them you have Parkinson's, the patients are kind of taken aback. Oh, they said, oh God, I don't think I have Parkinson's. This is just shaking of the hand. That's the only symptom that I have. I have Googled enough and I don't think I have Parkinson's. So unfortunately, Parkinson is a clinical diagnosis. When I say it's a clinical diagnosis, it means there is no one specific blood test or one specific scan by which I can tell you 100% sure that you have Parkinson's disease. So it's a group of symptoms and a clinical examination when the doctor checks you and he finds some important signs which we call our signs of Parkinson's, that he will label your disease as Parkinson's disease. In some cases we may get confused, so there are something called adjunctive test. That means they support the diagnosis of Parkinson's. They are not like a confirmatory test, and one of them is to check the same thing that I've been repeating from the beginning about checking the dopamine level in your brain. So we actually inject dopamine into your blood vessel and then do a scan of the brain to check whether there is enough dopamine reaching your brain. So if it reaches in the normal range, then you are normal. If it is not reaching, then we know that it is a positive thing for Parkinson's disease.
And what is the mainstay of the treatment in Parkinson's disease?
Correct.
Is there a very standard formula that is followed, or is it horses for courses, depending on the stage, etc., etc.? How does this whole treatment plan emerge?
Very true. So obviously, once you diagnose the patient for Parkinson's, we know that the main pathology or the problem in Parkinson's is the deficiency of this neurochemical substance dopamine. So the first line and the mainstay of treatment even today is to replace this dopamine. Okay, so we have enough medications which are primarily dopamine itself or something that is like a dopamine analog. That means that works like dopamine. So that way, the first and the most important mainstay of treatment is to start you on medications which will replace the dopamine that is less in your body. They are usually in the form of a tablet and they are fairly well tolerated. And once you start them on that, the slowing of the progress, in addition to the medication, there are many other important things that we will discuss in the future in the subsequent questions.
Because there is a lot of research which is going around across the world in Parkinson's.
Yeah.
And people keep saying that there are some breakthrough treatments that are emerging and all of that. So do you see a lot of positive hope around management of treatment for Parkinson patients over a period of time?
Absolutely. I think there is a lot of hope for treatment of Parkinson's patients. Like I told you, we know that there is a genetic mutation once the patients develop Parkinsonism. So the amount of advancements in genetics that we are seeing right now, I hope that there will be a day when we can use what is called as the gene repair. So we have a vector which is maybe a virus or which may be something like a small bacteria in which we can code that particular virus and inject it into the human body to say that, okay, you go ahead and repair this Parkinson gene. Is there any trial that is happening as of now? Yes, it's already started. But there are very, very few trials that are happening the world over, and it's not come to a stage where I can confidently tell you that, no, now we are sure, we know that we don't need any medication, just take this gene therapy, then you'll get better. So that is one part of treating Parkinson's in advancement. The second one is in terms of drug delivery. So we have a lot of newer devices. That means patients can have something like a subcutaneous pump. Like you must have heard about the insulin pumps. All of us are very well aware of that. So similarly, you have drugs which will give you these Parkinson's medicines under your skin slowly over a period of time. So you really don't have to swallow any tablets. So that is the other advancement that we are seeing in terms of medical treatment of Parkinson's.
So are there surgical options also, and how do you decide on which patient needs a surgical intervention,
Correct.
So what are the options, and what is the decision making process in that?
Correct. I think that is very, very important nowadays to understand. Like I was been telling, that Parkinson means it's not like that, okay, that's the end of my active life. I just have to stay at home and swallow medicines. It's no longer like that. There is a very, very good and efficient surgical treatment for Parkinson's, and that is intervened, or that is used at a very particular stage. Like I was just telling you a few minutes ago about an on and an off phase, where the patient has a good motor work is able to do, and the off period where he is not able to do. When this fluctuation, that means patients become severely off most of the day and have very few on periods, that is the stage when we suggest this surgery. What is this surgery? Surgery involves again modification of these electrical circuits that are there in the brain, which have become abnormal because of Parkinson's. So what we do is actually like science fiction. We basically put an electrode or a device which gives small dose of current, like how you have a pacemaker for the heart. Similar to that, we put these electrodes deep into a brain called the subthalamic nucleus, and that's one of the important pathways for this electrical circuitry in Parkinson's disease, and then that is connected to a pacemaker. So when we do this surgery, the stiffness becomes less, the tremor disappears, and the patients are very, very active and mobile. They may be still needing some low dose medication, but compared to what it was prior to their surgery, they have significant reduction in the medicine, as well as their quality of life improves dramatically, to the extent that we have patients who are surgeons, who are physicians, who have undergone this surgery and have gone back to do surgeries. We have patients who have driven all around India. One patient has driven from Bangalore to Nepal and come back after having Parkinson's, which is something unimaginable for a normal Parkinson's patients.
Very good. And what about this option of deep brain stimulation? I mean,
Correct.
where is it used, and what are the surgical steps
Correct.
in
Yeah.
DBS, as
Correct.
it's called?
So this is what was just describing is what is called as the deep brain stimulation. So the steps is it's a completely awake surgery. That means the patient is communicating with the doctor when we are doing this surgery, because we need to check how his response is. So we can't anesthetize him. If I anesthetize him, I won't know whether his tremor became
Okay.
less or whether his movements became free. So that is the first step of this surgery. We do an MRI scan, make sure we identify that area that we want to put the electrode correctly, and then what is called as an awake surgery, we put test electrodes into the brain. And once we are in the right place, we know that by the waveforms that we get, that we are in the right place, we start stimulating or giving a trial current in the OR itself. And once we see that the patient's symptoms improve, his tremors come down, then we put the final electrode and then connect it to a pacemaker. And there are a lot of recent advancements in pacemaker. I will just say a few lines about that. We have what is called as a rechargeable pacemaker. That means it's like your phone. All these wires are under your skin. Nothing can be seen from outside. So if somebody looks at you, they won't be able to make out whether you've had DBS or not. And this battery, which is under the skin, can be charged with just like a jacket, and that usually that battery will last for 25 years. Then we have what is called as non-rechargeable devices, or the non-rechargeable pacemakers, which don't need any charging at all, but their battery life is limited only to 5 years.
Okay, all right, okay. And what do you see as a neurologist's role in DBS patients? And
Correct. So I am a neurosurgeon and who specialized in movement disorder. Similarly, there are neurologists. Neurologists are our colleagues who don't do surgery but are experts in neurological disorders. So there are guys who are specially trained for this work, which is called as movement disorder work. So we need for these patients to be identified and treated by the movement disorder neurologist first. So he is the main person who is treating this patient. Once the Parkinson's patient reaches a state when he needs surgery, that's how he comes to me or the movement disorder neurosurgeon. So even during in the OT, he is the main person who will tell you whether all the symptoms have improved and whether his stiffness have become less. He keeps communicating with the patient during the whole surgery and then tells us, and both of them, myself and my colleague neurologist, we decide and find out which is the best spot for the patient. That means in that area of the brain, which gives the best response and the least side effects. And once we confirm that, which is very important for the neurologist also to be in the OR, we place the final electrode.
And I reckon that the post-op care is something which is very important, in the
Correct.
whole life cycle of Parkinson's and after the surgery, which can make quite a difference
Correct.
in the future life of the patient. So how do you see that, and what are your suggestions in taking post-operation care
Correct.
of a DBS patient?
Okay. I think Any surgery for that matter needs a lot of care and appropriate treatment during the post-op period. Otherwise, the whole purpose of the surgery is not served. Similarly, in Parkinson's, especially in patients who have DBS, we have this pacemaker which is already implanted. So we need to adjust a lot of parameters. Like any electronic device or a pacemaker, these have multiple parameters like frequency, the voltage of the current, the pulse width of the current, and all that. So myself and my neurology colleagues together, we do what is called as programming. So we choose an electric current and a frequency which is optimal for that particular patient. So this may not happen in the first visit. So this may take 2 visits, 3 visits, and sometimes 4 to 5 visits. So that is a very important part of post-op care. And the second important part is the family support. I think that is something that is unquestionable. You need to have a family which is completely dedicated in supporting this particular person who has Parkinson's, because they all play a positive influence on the patient. Like I was telling you, already these patients are very, very withdrawn. They become depressed. They don't want to go out. And if the family does not support and encourage them, then they become even more withdrawn and lonely, and any amount of surgical intervention may not help. So that is another important part of post-op care. And the third and the most important thing for any kind of a surgical recovery is rehab and physiotherapy, which is also very important.
Are there any other options that are available today based on the various research which is going around?
Yeah.
Or are these the ones that we have?
No, what happens in medical sciences, there are many therapies which are called as trial therapies, and there are some of them which are called as established therapies. So what I was just speaking to you about deep brain stimulation is an established therapy. It's crossed its stage. It's more than 30 years now. 1995 was the first time when DBS was started and it was done. So there are multiple scientific studies all over the world which have proven that DBS is an effective therapy for Parkinson's. Then they are called trial therapies, one of which I already mentioned was about injecting a vector with a gene modification which will repair the Parkinson's gene. The other common thing that many of our patients ask is about stem cells. So I would like to make it very clear in this talk is that as of today, stem cells have no role in Parkinson's. So please do not fall into the trap of saying that stem cell is a multipotent cell, you just inject, it will go into the brain and start producing dopamine. It does not happen, and as of today, we don't have any scientific evidence. If it is a trial, then it is fine, but please do not think that it is an established therapy. Through our societies, we are already communicating that to the lay public to understand and not to get fooled by some quacks who think that injecting stem cells may cure Parkinson's. So that is another important thing that they need to know.
And a lot of people sometimes think that there may be some more advanced treatments that may be available in Western countries and all of that. What is your view on that as to where we are as a country in terms of availability of options, implementation of those options, and does one really need to worry about and make that extra expense in just going and looking at the West to get some treatments done?
Yeah, it's another brilliant question, Mr. Rajiv. We really don't have to do that. That's the straight answer. We have what is available the world over right now in India, and we see that in all fields. Actually, we are the leaders in IT and engineering. So we have what is available in the West, even in terms of medication. I'm saying if a new medicine is probably introduced for Parkinson's or any illness, it's 6 months down the lane, it's available in India. That's the kind of advancement in medical science that is right now available in India. There is no logic. The DBS that is done here is the same that is done in the US. So there is no logic in trying to travel out to get something done that is easily available and at a much lower cost in India. Even in terms of some injectable medicines which were previously not available for Parkinson's disease, like an injection, even that is available right now in India, and I don't think there is any need to go abroad for any kind of a treatment for Parkinson's.
Very good, because that is something which is always in the minds of people. Am I
Correct.
getting what is available in terms of best in the world and all
Correct.
of that? Yeah, and I believe lifestyle changes can also make an impact in
Correct.
the whole future of the person who's been inflicted with Parkinson's. And unfortunately, what is your view on that? What are the key lifestyle changes that can make a difference in that?
Correct. I think that is very, very, very important. How much of a medical intervention or surgical intervention that we do, none of them will have the desired effect unless we make the lifestyle changes, whether it may be diabetes or whether it may be something as complicated as Parkinson's. So I think it is most important to have lifestyle changes, and what we always suggest, one of the most important lifestyle changes to do exercise. It may be any form of exercise. It may be cycling, it may be walking, it may be doing yoga, it may be doing a gym or cardio, whatever you like. Swimming is a very good exercise. So any kind of an exercise is one of the most important message that we want to say is absolutely essential. I know many of our friends in IT or in any industry for them or in service industry feel that they don't have time. I don't think that is true. Please, you have to make an effort, at least do 30 to 45 minutes minimum of exercise either in the morning or in the evening that you have. And for patients, somebody who is already having Parkinson's, like I was telling you before, it is very important or all the more important for them to do exercise, because that is the only important scientific thing that we know which will slow down the progression. So if you don't do exercise, just keep swallowing pills or undergo surgery, it may not stop the progression. But if you do all this, in addition to that, you put an effort and do regular exercises, definitely there is a significant improvement in your Parkinson's symptoms.
I'd also like to just get your thoughts on, typically in most of these ailments, we look at aspects like, in three different aspects, like prevention, intervention when you're inflicted with the ailment, and there is the post-intervention care.
Correct.
Is there any thoughts you would like to share in terms of prevention part of Parkinson's?
Correct. So as of now, we really don't know anything that we can do to prevent, except like I was repeatedly telling you about exercise, because like I told you, we don't know any particular reason why somebody develops a Parkinson's. It's still in what is called as idiopathic Parkinson's disease. So that means we really don't know the reason why somebody developed Parkinson's. So in terms of prevention, again I'm stressing the important thing is to do regular exercise. In terms of intervention, we already discussed that in detail, both medical and surgical. And the last and the most important thing is about post-intervention. What do you do? So post-intervention also is equally important, not only in terms of coming for programming like I was telling you, but also to make sure that there is enough care at the place that you live. It's very, very important to make sure that you don't have falls, you don't have other injuries, which also can complicate your Parkinson's. So then it becomes a much more difficult challenge for you to, take care of yourself.
And where would you say India stands today in terms of number of people affected or percentage of people affected with Parkinson's as compared to some of the other geographies?
Correct. So there is not much of a difference between, say, India and the US in terms of the prevalence or the number of people affected. So like I told you, maybe 4 to 5. We have one Indian study, like I told you, from NIMHANS, another Indian study which is from Bombay, where I train, about prevalence of the disease in Parsis. So in that we have found that among the Parsi population, there is a slightly higher incidence of Parkinson's as compared to the general population in India. Otherwise, it's almost the same as it is in the rest of the world.
Okay. All right. So, Dr. Raghuram, thank you very much. It's excellent. What would be your final message to public at large and maybe to the relatives and friends and the whole sort of ecosystem that sits around a person who may have unfortunately got inflicted with Parkinson's?
Correct. So the whole gist of this program is to raise awareness about Parkinson's. So my most and very, very important message is the fact that please do not lose hope if you are diagnosed with Parkinson's. It's not something that is like going to be like an end of life or an end of story for your activity or for your normal life. There are enough and more medical as well as surgical interventions for you to choose from and get significantly better. Significantly better, when I mean, is to almost reach your normal activity that you were probably doing before you were diagnosed with Parkinson's. So that is the extent of therapy that is available for treating patients with early stage or a second stage Parkinson's disease. So there is no reason for you to lose hope. And again, the most important thing is, even if you are not doing any other surgical intervention, just take regular medications as well as do regular exercise. These two things will make a significant difference in your quality of life, and there is no need for you to feel lost and hopeless.
Brilliant. Thank you very much, Dr. Raghuram. A very informative and a very candid description of the disease and the possible options that are available, and why people should not have this scare sitting over them about this whole disease. So thank you again very much, and I'm sure people will follow some of your advice, especially in the area of regular exercise and all of that, which not only for Parkinson's generally is very valuable.
Thank you very much.
Thank you again.
Thank you. Thank you.